At a county health department in Georgia, students gather for emergency preparedness training. On the Emory University campus, other students discuss research on reducing the risk of sexually transmitted diseases among young people around the country. And in Africa, Emory students and interns spend a summer searching for ways to suppress HIV transmission. Students and faculty may be scattered, but the one address they all share is the Rollins School of Public Health at Emory University. And while their work varies, they're all engaged in one mission: promoting health, preventing disease. Locally, nationally, globally.
When we see a health disparity, when we see a public health problem that can be righted here in the United States or throughout the world, we want to change it.
Dean Jim Curran personifies the sense of urgency in public health at Rollins. So much so that Rollins is among the top 10 schools of public health in the United States and the fastest growing school of its kind in the country.
We have the will to change it, and we need to have the skills to change it.
Dean Curran was already a pioneer in AIDS research before coming to Emory. Under his leadership, Rollins has now become one of the largest centers for AIDS research in the country. That reputation drew Joe Barker, who spent a summer studying HIV transmission in Kigali, Rwanda.
As an MPH student, I've had opportunities to work on research projects that most of the time MPH students would never get their hands on.
Joe worked at one of the African clinics headed by Dr. Susan Allen, an international authority on AIDS and HIV. Her clinics are just one of the many international locations where Rollins students earn hands-on experience. A unique opportunity, Dr. Allen says.
I looked for those opportunities and to do international work. It's very hard to find institutions that will support trainees in that way.
Field experience is an integral part of the Hubert Department of Global Health at Rollins. There's a variety of projects, from safe water to childhood nutrition to AIDS prevention, and students usually work right beside Rollins scientists.
Emory has people who have actually had to make a payroll in a developing country.
Professor Bill Fagey should know. He was among a handful of scientists who finally eradicated smallpox. Dr. Fagey's legendary work in global health has earned him top positions at the CDC, the Carter Center, and the Gates Foundation.
So it's a great place for a person to make a difference in the world.
The opportunities to make a difference even closer to home are nearly limitless at Rollins. Making water safer in the desert Southwest, searching for less invasive tests for cancer, investigating healthcare policies, finding more ways to access healthcare, and determining the impact of mental illness on populations are just a few. Dr. Benjamin Druss is the first scientist to be selected Rosalind Carter Chair in Mental Health, an exclusive position among public health schools.
If you look at burden of disease in the developed world, mental conditions are really among the top causes of burden in terms of disability and years of life lost.
Actually, Arnold's going to be involved in a lot of
This group works with doctors Ralph DiClemente and Gina Wingood. The husband and wife team are behavioral scientists, internationally known for their work on sexually transmitted diseases and HIV prevention. They're eager to share their findings.
We want to take the next step. So we collaborate with CDC to train trainers from around the country to implement the programs we develop. This way they reach thousands and thousands of people in all the states of the country.
The thing that's nice compared to 10 years ago is that now when we do this, we have a lot of our alums at the tables.
Whether it's at a job fair, in a lab, or a classroom, Rollins is with you every step of the way. Jean Lee works in the bioterrorism department at the CDC now, partly because of her work-study time there.
A lot of work-study jobs that my classmates and I got were through Rollins, and were in the public health arena, which I think is very difficult to find at other schools.
It was nice that you had that opportunity to work with a professor who worked at the CDC and learn from him, and then go right across the street and do an internship there.
Nidhi Prakash earned a master's in healthcare management and works now as a consultant at an international firm.
The opportunity that exists here, I don't think exists anywhere else. Rollins has a great name.
Identity wasn't the only drawing card.
I would definitely say the location.
Rollins School of Public Health at Emory is one of a cluster of prestigious science centers situated together, earning Atlanta the reputation of the public health capital of the world.
I would never think of going anywhere else because, I mean, there's so much out there.
You'll find a unique spirit and culture when you study at Rollins.
Professors were around and they were accessible.
Kathy Hageman is enrolled in a new PhD program.
And if they couldn't talk to you right then in the doorway and invite you in, they would always say, you know, just shoot me an email and I'll meet with you as soon as possible.
She earned her master's at Rollins, and the nurturing atmosphere influenced her to stay for her doctorate.
When your primary teachers are the professors themselves, you get a real sense that they care about you.
That sense of caring impressed Dr. Pranay Ranjan, who's studying leadership in public health. When he arrived from India, he recalls first being impressed by the beautiful campus and then thriving in a welcoming atmosphere.
I think there's no better environment for somebody to flourish in than one that is completely accepting and encouraging.
Rollins prides itself on drawing students from all over the world and not only educating them, but also working with them.
We're very fortunate to be at Rollins because we have excellent students. And those excellent students are very helpful because I think by working on our programs, they have a real sort of realistic or hands-on approach to how program development and implementation does occur in communities.
They take your feedback seriously as well, and they want to work with you.
Joran Grants enrolled in Global Epidemiology, a new program initiated by students.
It's a direct reflection of how student involvement and student feedback is taken seriously because it was a request that was made over a course of years by students saying that these two fields, you know, really would do well to merge.
That may have been the inspiration for her and others to initiate a new volunteer program.
We get training on outreach and how to respond in emergencies, preparedness, as well as we assist in real live hands-on outbreak situations.
They meet at a county health department arranged by Darren Collins, himself an MPH candidate in the Career MPH Distance Program.
I would tell you that public health is all about relationships. That's a theme that's stuck with me for a long time. Public health is kind of a small community, and building and maintaining those relationships is critically important to the work we do.
Making a difference can be as close as a lab in Atlanta or as far away as a village in Africa. The journey to your discovery begins at Rollins.
Students come to Rollins with a variety of backgrounds, a variety of cultures.
I have the job I do today because of this school, because of the people I knew here, because of the education I got, and it's a great feeling.
And what they share, in addition to being very bright, is an enthusiasm to make the world a better place.
I was overwhelmed with the quality of education that students got here.
They're optimistic that they can do it. They are the next generation, and we will provide them the training they need.
It's definitely changed my life.